Hello everyone, in this video I'll talk about body surface anatomy. I will only discuss the head, neck and trunk only. I will make one more video on this upper limb and lower limb body surface anatomy. Firstly I will discuss the anterior surface anatomy of axial body, and then I will discuss the posterior surface anatomy. Firstly, um, first surface anatomy landmark is larynx. You can see in this image, this one is the highlighted one is the larynx. Points to remember in larynx are: firstly, larynx is superficial to the esophagus and it is situated from third cervical vertebrae to sixth cervical vertebrae. This larynx is also known as voice box because it produces sound, and this larynx is a hollow structure that composed of many cartilages like thyroid cartilage, arytenoid cartilage, cuneiform cartilage, like that. I mentioned here thyroid cartilage only because it has one important feature, which is Adam's apple. This thyroid cartilage forms laryngeal prominence. Prominence means something that is raised or protuberance like that, and this formed or raised prominence from the thyroid cartilage is called Adam's apple. Next surface landmark is SCM, sternocleidomastoid muscle. Firstly, it is a two large headed muscle of the neck which are located lateral to the larynx. It is a two large headed muscles, meaning it will have two origins. Firstly, one origin is from the sternal head and the other origin from the clavicular head. The sternal head is exactly from the manubrium of the sternum, and the clavicle head is medial 1/3 of the clavicle, and they originate, the two large head muscles originates from here, sternal head and clavicular head, and they inserted onto the masseter process of temporal bone, which is lateral part of the superior nuchal line of the occipital bone. In this image you can see the ACM. This one is the ACM. It is originated from, this one is the sternal head and this one is the clavicular head. I hope you can appreciate in this video. For the insertion, it is exactly right here. You can see in this image. Our next landmark is clavicle, which is also known as collarbone. You can see in the highlighted color green, that is the clavicle. Next one is supraclavicular fossa, which is a shallow depression that lies just above the clavicle. It extends SCM medially and deltoid muscle laterally. This one is supraclavicular fossa. From the word itself, you can easily understand the supraclavicular fossa. Supra means superior to something. In this word, it is clavicular, so supraclavicular means something that is superior to the clavicle. Fossa means something that is depression or depression like that. So supraclavicular fossa means it is a shallow depression that lies just above the clavicle. You can see in this video, it is above the clavicle, that is the supraclavicular fossa, and it extends. This one is the medial surface, so you can see SCM here like this, and it extends SCM medially, and deltoid muscle is around here, deltoid muscle laterally. Okay, that's the points to remember. Those are the points to remember in supraclavicular fossa. Our next surface landmark is sternum, which is very important. Sternum is a anterior bony landmark that articulates with first 7 ribs and clavicle on either side, and it consists of 3 parts: manubrium, body and Gifford process. The highlighted one you see is the sternum. It is located anteriorly, and it articulates with 7 ribs and clavicle on either side, like either side meaning both sides. This sternum is consists of three parts: manubrium, body, and Gifford process. I will show their pictures. The upper one is the manubrium. This one, the middle one, is the body, and the inferior one is the Gifford process. Now points to remember in sternum one. Firstly, manubrium. It is located superiorly. It can be palpated between the clavicular heads. You can see these two are the, this one is clavicle, this one is another clavicle. This one you see right here is the manubrium of the sternum. It can be palpated between these two sternal heads. This manubrium, it is a large quadrangular shaped bone. Before discussing the body of the sternum, there is two important features here. Firstly, jugular notch of the sternum and sternal angle. This one is the jugular notch of the sternum. The jugular notch of the sternum is located superior aspect of the manubrium of the sternum between the two sternal heads. This notch is also known as suprasternal notch. This one, that's the small one you see right here, is the jugular notch of the sternum. This is also known as suprasternal notch. It is also one of the surface landmark. And the next one is the sternal angle. The lower border of the manubrium of the sternum articulates with the body of sternum at the sternal angle. In this video, in this picture, you can see this one is the lower border of the manubrium of the sternum. It articulates with the body. This one, the highlighted one in the green, is the sternal angle. It is palpated 2 centimeters below the jugular notch, and it is in line with the second rib. Simply, if there is a question regarding what is sternal angle, it is located at the lower border of the manubrium of the sternum, articulates with the body of the sternum. That's the region where sternal angle presents, and it is palpated 2 centimeters below the jugular notch, and the sternal angle is in line with the second rib. Now let's go to the second part of the sternum. First one is the manubrium. Now second one is the body. It is the longest part of the sternum. It articulates with the ribs 2 to 7. Since it is middle part of the sternum, superiorly the superior part articulates with the manubrium, and the inferior part articulates with the Gifford process. In this picture, you can say that this one is the body of the sternum. Superiorly it articulates with the manubrium of the sternum, and inferiorly it articulates with the Gifford process. Now lastly, the Gifford process, it is inferior part of the sternum. It can be palpated below the chest. This one you see right here is the Gifford process of the sternum, which is inferior part of the sternum. Our next surface landmark in the chest is pectoralis major muscle. Firstly, it is located below the clavicle and lateral to the sternum. This is the largest superficial muscle of the chest. You can see it is present below the clavicle, okay, and it is the largest superficial muscle of the chest. And this one is the sternum. You can see it is lateral to the sternum. This one you see right here is the costal margin, which is our next surface landmark. This costal margin is formed by the cartilages of ribs 7 to 10. Next anatomical landmark is rectus abdominis muscle. Simply it is known as six-pack muscle. It originates from the pelvic bone and sits at Gifford process and lower ribs. In this picture you can see the rectus abdominis muscle, simply six-pack muscle. You can see this is the origin. It originates from the pelvic bone, and it inserts here at the Gifford process. And There are some lower ribs. You can see this one, these are the lower ribs. Okay, this one is the insertion, Gifford process, and lower ribs. Next anatomical landmark is linea alba. It runs midline of the abdomen. It extends from Gifford process to the pubis, and it separates the rectus abdominis muscle. This one you see is the rectus abdominis muscle. Now there is a midline which runs midline. This line is called linea alba, which runs midline of the abdomen, and it extends from, this one is the Gifford process to the pubis. Okay, from Gifford process to the pubis, and it's this line separates the rectus abdominis muscle. Okay.